This video is brought to you as part of the Paired Health Mobile Medical Care Educational Series. Hi, I'm JB Powell, and in this module of the Mobile Medical Care Educational Series, I'm going to review a number of process and activity metrics that are extremely valuable when assessing your home visit program's activity and efficiency. There are, of course, the outcomes and metrics that are important to the large picture goals of your particular program. For example, readmission rates, length of stay, ED gridlock, and the list goes on. However, by paying close attention to a set of key activities and process metrics, you will be able to derive impactful information that will lead you to becoming better educated in the areas that you can become more efficient and ultimately drive better outcomes and results for your program. A recent study published in Health Affairs examines the impact of transitional care interventions in reducing readmissions for adults with chronic illnesses. The results of the study show that while transitional care was effective in reducing all-cause, intermediate, and long-term readmissions, only high-intensity interventions seem to be effective in reducing short-term readmissions of 30 days or less. These findings suggest that to reduce short-term readmissions, transitional care should consist of three elements. 1, care coordination by a nurse. 2, communication between the primary care provider and the hospital. And 3, and most importantly, a home visit follow-up with the patient within 3 days after discharge from the hospital. Much of what I will review here is applicable to transitional care programs specifically. However, by monitoring these key activities and efficiency metrics, it can certainly be relevant to any time-sensitive home visit program. When I talk about program process metrics, I'm referring to the analysis of data that provides insight into program operational efficiency and adherence to program guidelines. These are the measurements that can help you to shed light on the factors that are positively or negatively impacting program outcomes. For example, a health system running a transitional care home visit program identifies an efficiency breakdown in their enrollment to first encounter process, resulting in an increased time from patient discharge to when he or she receives that initial home visit. And this may be longer than what was intended to be prescribed for that patient's particular risk level. In many cases, this can leave far too much time for the condition of a complex, high-risk patient to deteriorate before the provider is able to reach them and conduct that initial home visit exam. The following are examples of efficiency metrics that can be tracked to raise awareness of such issues and enable you to make necessary changes that will improve your program overall outcomes and results. 1, as just mentioned, the time from patient discharge to first visit, or how much time it has elapsed between the point of when the patient has been discharged to that first patient encounter, is extremely important. This metric provides insight into whether program goals are being met. For example, all high-risk patients must receive an initial home visit within 2 days of discharge. Also, looking back on readmissions, these data points can tell you how the timing and frequency of each patient's visits impacted their program's outcomes. And by aggregating this particular case with other patient cases, you can uncover a trend that is particularly useful in establishing the structure and guidelines of your overall program. Here you see an example care plan where a high-risk patient should receive a home visit within the first 2 days after discharge, and then again on days 4 and 11. If that initial visit does not happen within 2 days of discharge, it's more likely that the patient could bounce right back into the hospital or ED. Another compelling data point for transitional care programs to be able to track is the completion rate of patients that transition back to their primary care physician. In other words, how many patients were confirmed to reach their primary care physician, and in what time period was that appointment? This metric provides important insight into the transition of care to the next provider and can indicate gaps in coordination, resources, and system needs. In the example care plan shown here, you can see that the patient should be transferred back to their primary care physician in this particular scenario 14 days after being discharged. Being able to track the rate at which this primary care handoff is confirmed versus when it is not can be crucial in making important adjustments to your transitional care program. Finally, for hospital-wide referral-based programs, another telling metric is tracking your program's referral to enrollment conversion rate, or the percentage of all patients who actually receive a home visit divided by the total number of patients who were recommended for a home visit. There can be multiple reasons for non-enrollment that ideally should all be tracked. Some of these include patients that were unable to be contacted for a number of reasons, patients who refused home visit services, patients whose home environment was deemed unsafe or the particular situation was deemed unsafe for a provider home visit, in addition to many more. And providing insight into the overall program acceptance rate can present opportunities to improve this conversion rate and see more of these patients who would otherwise go without an intervention. There are also a number of activity metrics that your program can track that will enable you to assess and analyze a number of key statistics. And taking it one step further, as you're able to make these metrics available in real time, you can provide insightful trending analysis on program activities that will help you to manage the detail of your program from multiple angles. Plus, have the control and management of your program that you need to be successful. Taking a quick look at some of the examples of activity metrics shown here, you can track referral activity, so the number of incoming referrals by location or referring individual. Risk stratification activity, so the inputs for the risk algorithm that you choose to use and the resulting risk score for each patient. Home visit volume by unique patients, encounters, insurer, geography, etc. Patient activity volume, number of phone calls, number of visits, timing and frequency of phone calls and visits. Mobile activity, number of miles driven per provider per week, distance traveled per provider per week, etc. And then the billing and coding activity, so the encounter volume by CPT code for each type of home visit delivered. To learn a little more about how the Paired Health platform enables the easy tracking of and reporting on these patient level activities and process metrics, look for our software demo videos coming soon. By tracking these simple program process and activity metrics, you will be able to continuously monitor your program for efficiency gaps and ultimately realize better outcomes for your program. Thank you for watching this segment of the Paired Health Mobile Medical Care series. Remember to check out the rest of our series and much more at www.pairedhealth.com.